Hello, followers of Neuro Takeaway. Today, I give you some breaking news about a congress that's taking place right now, virtual, the ACTRIMS Congress. It's about MS, and there were two fantastic sessions, Advanced Imaging 1 by the NIMS Magnums groups and Advanced Imaging 2. So let's take a look. This conference was given by Pascal Satie. He showed some amazing images about MS pathology with a 7T magnet at the sub-millimeter scale. On the upper right corner, you can see the central vein sign, which is present in about 80% of more of cases of MS with this technique. This is the T2 star on a 7T. And he compared this prevalence with other processes as non-specific white matter lesions, where they are present in about 20%, or NMOSD 35%, or Susak syndrome around 50% of cases. In the lower right corner, you can see the presence of iron, the accumulation of iron in the basal ganglia during the evolution of MS, both on T2 star and QSM sequences with a 7T. Then in the upper right, you can see the presence of two very tiny lesions in the thalamus, one in the central region and the other one in the paraventricular region with a central vein. And finally, the presence of some cortical lesions in the lower right image with a central vein inside them. This conference was given by Dr. Olga Ciccarelli from Queen Square. She spoke about spinal cord atrophy. She showed that spinal cord atrophy progresses at faster rate than brain atrophy. She showed also some new automated image registration techniques that increase precision and reduce variability of longitudinally spinal cord atrophy quantification. And she stressed the importance of further research to understand the role of asymptomatic spinal cord lesions to monitor MS activity. The conference was given by Dr. Franziska Hildesheim from the Buffalo Group, led by Dr. Sivadinov. They basically spoke about the meningeal enhancement on 7T magnet with a 3D flare sequence with a subtraction technique, and they show three patterns of enhancement. The first one was the leptomeningeal, that it was known already, and it had been associated with atrophy, more cortical and white matter lesions, more disability of the patients, and especially in the progressive forms. But now they showed another two patterns: the meningeal vascular enhancement and the dura mater enhancement. And the most striking finding was that the dura mater pattern of enhancement was the most prevalent. It was found in around 50% of cases, and it was related to the T1 and T2 lesion load and with deep brain atrophy. On the other hand, they showed the close match between these areas of enhancement, the dura mater and the vascular, the meningeal vascular, with the recently described lymphatic channels that now can be seen in the brain with 7T magnets and flare sequences. So maybe there is a link between these two findings. Well, the speaker in this talk was Omar Al-Lousi. he presented new criteria for the detection of the central vein sign that, in comparison with the classical names guidelines presented in 2016, allows the inclusion of smaller lesions. Remember that the names guidelines exclude the lesions smaller than 3 millimeters in any plane for this sign. This new system called XOL is also more sensitive than the Select 3-star guidelines, so he proposed to follow it in the future to include more central vein sign lesions. Well, this talk was given by Dr. Susan Gauthier. She spoke about QSM. QSM stands for Quantitative Susceptibility Mapping. It's a relatively new sequence, very similar to SWI. It's a 3D gray sequence, but with the use of multiple echoes that allow the detection of a small amount of iron, for example. And the other important thing of QSM is that it can, with it, you can quantify the amount of iron. Remember that iron is extremely important. It has been found inside macrophages at the periphery of some lesions, the so-called cells, slow expanding lesions or chronic active lesions. This was one of the most extraordinary findings of recent years in MS imaging. These lesions are a marker of activity besides the contrast enhancement, and she explained that QSM detects not just iron but also demyelination itself, so they both contribute to this increase in QSM. She also talked about the utility of QSM for detecting the age of a plaque. You can differentiate with this sequence acute from chronic plaques, and she also showed some preliminary data about the utility of QSM to detect treatment effect on these lesions. That is very, very important for the utility of drugs on the progressive phase of the disease. And finally, she showed the potential role of QSM for detecting iron in the deep gray matter. Well, in this case, Dr. Reza Ramanzadeh also talked about QSM and its utility for classification of the lesions in MS. He said that on QSM you can find iso or hypointense lesions that are probably remyelinated. You can see hyperintense lesions without rings that are chronic inactive lesions. And finally, you can see the cells, the chronic active lesions, which are hyperintense with an iron ring. And he also talked about the heterogeneity of lesions in MS patients, and I think it is very important for the future to try to understand the complexity of this hyperintensity that we used to see on classical FLAIR and T2 sequences. In this conference, Marlos Hagens spoke about another exciting technique that is microglia PET. She explained the limitations of our standard sequences for interpreting the characteristics of the plaques regarding pathology. As you know, microglia is very, very important, and with PET we have some new markers of microglia. There is a protein expressed at the periphery at the surface, external surface of the mitochondria, the TSPO. It's like receptor for benzodiazepines. Now we have several molecules that can bind to this TSPO, which is typical of microglia. One of these markers is the PK11195. With this, we can see microglia. We have to know that this TSPO is also expressed in other cells like astrocytes and endothelial cells. So we have to take it with care. On the other hand, this microglia has two flavors. It can go to a pro-inflammatory state, which is the one that we found at the periphery of the chronic active cells lesions. On the other hand, it can be an immune regulator, and those states are interchangeable. So it's very important to understand all these pathophysiological background to interpret correctly this microglia PET imaging. Well, this was another exciting conference by Annalisa Colombi. She talked about perfusion in MS patients. As you know, there are two kinds of patients, the good remyelinators and the bad remyelinators. And in fact, nobody knows exactly what differentiates them. Maybe there are several factors, but one of them may be perfusion. Other potential causes are the topography of the lesions. You know that, for example, black holes are found mainly at the border of the watershed areas of the brain, or the immune system state of each patient. But regarding perfusion, they developed a technique that used PET with a very well-known marker, the B compound of Pittsburgh. It is a marker of amyloid. That's why it's very well known for all radiologists, because we use it in dementia patients. But in this case, it is also a marker for myelin. So they developed a technique, the dynamic PET technique, that allows the simultaneous assessment of perfusion and dynamic myelin content changes in MS plaques. They demonstrated that higher perfusion in demyelinated tissue is an independent predictor of myelin repair over time. And so they concluded that perfusion plays a role in determining the heterogeneity of remyelination in MS lesions. Well, this is over. I hope this snapshot of the Congress has helped you understand the most recent advances on imaging in this very disabling disease that affects young people nowadays.